The majority of heart attacks occur with blockages that are under 50%. So it's like a pimple that's built up inside the vessel wall, inside the artery wall, like a pimple on our face, but inside the vessel wall. If that pimple pops, no big deal on my face. But if it pops inside the vessel, there's your heart attack or stroke. You'll miss 90% of heart attacks looking at a stress test. The doctor just has to say the right things to the patients. Look, you have a good fitness level. Seems like your heart can work well under loads. Doesn't mean that you're not immune to a heart attack. You could have one leaving this office. So please make sure you pay attention to your lifestyle.
You're listening to the Lifestyle Medicine Podcast with Dr. Ivan Rusilko, brought to you by Access Lab, where we explore new perspectives at the forefront of personalized healthcare.
Welcome to the Lifestyle Medicine Podcast. I'm Dr. Ivan Rusilko, and we are brought to you by Access Labs. If your doctor's not checking your labs, they're not a doctor. And today we got Diamond Fernandes. He's the owner and operator of HeartFit Clinic and a well-established author. So we are going to talk about everything cardiovascular today. How you doing, Diamond?
Doing very well. Thank you for asking.
Well, thank you so much for stopping by. And again, this is one of the things I tend to see in all of our podcasts. It always comes back to cardiovascular health, whether we're talking about ED or we're talking about cholesterol medication. So there's a lot of stuff I'd love to chat with you. So I hope you are ready to rock and roll.
Let's do it.
All right. Well, first, tell us all about your clinic. I'm very curious.
The HeartFit Clinic in Canada, we're in a public healthcare system. And so what we do is we bridge a gap in our healthcare system to help people prevent and reverse heart disease. So we provide heart assessments, treatments to be able to help people bridge this gap in the healthcare system, because going to your family doctor, even in the US, is too basic. It's like, okay, well, follow the Framingham heart score. We'll check for cholesterol, blood pressure, diabetes, and, important markers. And cholesterol is not what causes heart disease. And we'll get to that in a bit. But it's about understanding what the gaps are in the healthcare system to prevent and reverse heart disease. So that's what we do for our clinics here. And yeah, so we've got clinics across the country to help people prevent and reverse heart disease.
Oh, I think that's fantastic. And again, I love what you brought up. I mean, cholesterol is probably one of the most important things in our body. 25% of our brain, all your sex hormones, vitamin D and things like that. It's been bastardized and just chopped up so much about how it's bad for you, this, that, and the other. Could you give me kind of the abridged version of your thoughts on cholesterol and how the industry has kind of taken it and just demonized it?
Well, it started on purpose because, here's the thing. They opened up a cadaver of an artery in the 70s. And when they opened up a cadaver of a diseased artery, they found two things in there, cholesterol and fat. And that's where our nutrition got geared in the 80s, 90s, early 2000s, even to today. It's like, stay away from cholesterol, stay away from fat. It's clogging our arteries. That was all not scientifically based. And that sounds silly, but how can a whole food industry be geared to it had zero scientific basis behind cholesterol and fat is clogging arteries. That's not what happens. But what got pushed along the way is that statins got produced at that time.
How convenient, right?
And so, it's like, hey, if cholesterol is inside this vessel and if we lower it, then we can lower heart disease. And by the way, that did show. So, I mean, if we're going to be research focused, if we lower cholesterol, we lower risk of heart disease. That's true, but very minimal. Like it's not true to the extent, because if it's true, now we have drugs out there that can lower with that and statin. We can lower LDL cholesterol like to the toilet now. We can get it to the toilet. But even if we do get it down to the toilet, meaning nothing, like almost zero, or back to where you were born with, we're still seeing heart attacks and strokes. So really what my point is it goes beyond cholesterol. And so pharmaceutical did a good job of pushing that narrative that cholesterol causes heart disease. Food industry jumped on it. Every label was about lower cholesterol, lower fat, lower cholesterol, lower fat. Everyone remembers that. Everyone remembers that. That was that age, 80s, 90s, 2000s, even to today. We're still, it's still about people think that cholesterol accumulates to this pipe and you have a last piece of pizza and you end up with a heart attack, and it doesn't happen.
No, very true, very true. When it comes to looking at the actual heart markers, because again, it's a very diagnostic-driven world these days. You obviously have HDL, LDL, total cholesterol, triglycerides, which are kind of the overall aspect of what cardiologists and even regular family practice doctors look at. What we personally look at our clinic is HSCRP, PLAC, the apolipoproteins, SDL, LDL. Are you looking at that stuff too in Canada, or are you looking at something more
we got
beyond that?
more advanced markers. So just coming back to where I was coming from there. going to your family doctor is too basic because they're still stuck in Framingham world, meaning there's this Framingham heart study that showed that if we plug in all these formulas, we get a risk profile. Too basic. And if you go to a cardiologist, people are all like, well, let's get a calcium score and a CT angiogram and see what, and that's too advanced and you don't need to go that far. And especially not worth the radiation as well when we're talking about it from that perspective. So it's like, okay, well, where do we fall? And that's where Heart Fit Clinic bridges that gap. And so when we talk about the artery wall, there's a lot of biology to this vessel wall. It's not, so you already talked about inflammatory markers, there's particle sizing that happens. And so all those things are way more important than just looking at cholesterol alone. But then there's infection and immune response. So I always like to keep it simple. Imagine the lining of the artery wall, it's all skin, it's called the endothelium. It's the largest organ in our whole body. If we open up all our vessels, it would go around the world a few times. And now we're talking about the inside of the vessel. So the endothelium is large. And so that can get damaged. Things can get through, like a sliver on our hand. And a sliver can get infected when it goes inside our hand and we're not able to poke it out. So that similar process happens. It's a process. It's not cholesterol accumulates to this pipe every time we have a piece of whatever, cheeseburger. It doesn't happen that way. And so that's where it's important to change that narrative. And I think it is being changed. And I think it's important that it is get changed. But this is where cardiologists think that they're smart by just giving and prescribing statins. But really, like I have very good friends that are cardiologists and the data shows it. So I'm not going to deny the data.
Yeah, no, for sure.
But very minimally. And so you have to be able to say, like, there are guidelines. And when you talk to doctors in the conventional healthcare system, they have to stay in the guidelines and don't get mad at them. Like, you can't get mad at someone for staying in guidelines because if you don't, we're in a world now that if you fall out of guidelines and you tell me to do X, Y, Z when you should really be doing ABC, well, and I have a heart attack over on this side, well, guess what? I lose my life. I lose my livelihood. I went to school for X years and now all of a sudden everything's gone. So it's not getting mad at, it's the process and how the system is pushed. And so how you fix it is hard. And I'm not here to fix it. I'm not a policy guy, but it's the idea of it goes beyond your family doctor, and cardiologists are trained to deal with ischemia or lack of blood flow or an advanced stage of a heart problem. And we're thankful for them when you do have that. If you're having a heart attack, go to the hospital. Don't skip that. Go to the hospital. It's life-saving. If you're having a valve rupture, go to the hospital. If you're having, arrhythmia, go to the hospital. Those are things that are life-saving.
Yep.
And that's what they're trained to do. They're not trained to prevent.
No, very true. And again, so when it comes to your patient walks in the door fresh off the street, you can look at them. Obviously, they smell like cigarettes. There's an issue. If they're morbidly obese, there's an issue right there. But when it comes to the actual testing of them, is it more intake? Is it more lab testing you guys are doing? Or what's the process for you guys when it comes to
all of the above is important. There's lab testing to be done. It's important to look at the artery health and function and stiffness and do a version of a test to see what's happening in terms of a CPAT or something like that to be able to test the arteries health very well. So those are all important things to do.
Those are the important ones.
Yeah.
What about
And a lot of blood work,
hyperglycemia?
my goodness, looking at nutrition to hormones to genetics. There's a lot of things that you can get into to see what's happening.
What are your thoughts on hyperglycemia?
It's a big deal, but insulin resistance is the marker that actually gets missed now. Is that when we talk about insulin resistance, that's a bigger deal. And that's where the birth of GLP-1s have come out and play to help people with that part of it. And so now we've got these GLP-1s, GLP-3s, and they're all coming out because it lowers, well, people are using it. It was a diabetic drug. And then there was a study that came out a few years ago, and it talks about how the use of semaglutides in patients that are not diabetic with cardiovascular disease had good outcomes. What does that tell us is that overweight is an issue, insulin resistance is an issue. So those are factors that are very important. Now, the problem with GLP-1s is that you'd have to stay on them and people may not be able to tolerate a dose or a high dose of it. But the benefits, like people will go and walk across the earth just to lose weight, right?
Yeah.
No pun intended, you probably could do that if you did that, but it's like people will go to extreme measures to lose weight. And, now you have a drug that'll do it and they won't care about the side effects because of the benefits of weight loss. The problem is if you gain it back, that's the issue.
Yeah, that's a big one.
That's concern. And so my concern is not for the people. It works. The data shows it works, but you got to be able to prescribe these really smart, meaning You have to be able to make sure the patient's doing strength training. You have to make sure that other lifestyle habits are in play. And so it becomes way more important than even not being on the drug. Because if you're going to be on the drug and you come off of it, that's where the data is going to catch up with us and show more harm than good.
No, no, no. True, true, true. Now, you wrote a book called The Death of Stress Testing, correct? Can you expand on that? I'm very curious because everything stress testing is going to save your life, and it's kind of
Yeah, yeah.
a conundrum here. I'm curious.
Oh gosh, the stress test was invented years ago, and it's really a great test to understand artery health, advanced stages of disease. So what it was meant for, if someone was having angina, which is chest pain or some kind of chest discomfort, the idea was the stress test was used to confirm whether that was angina or not. So that was the intention behind it. The problem is that every executive and everyone on Wall Street wants to get a stress test because they're like, well, gosh, I'm I'm s- I get stressed doing whatever. And so they used it so much they actually incorporated the terminology in financial markets and stress test the markets and all that is the same idea. It came from the medical side of things. And so the stress test sounds like I wrote the book, Death of the Stress Test, and it sounds like I really hate it. And I actually really love the test. I think it provides the practitioner, the clinician, a lot of valuable insights as to what's going on, especially from a cardiovascular fitness. What I hate are the outcomes.
Okay, go
And
on.
yeah, and so this is why I wrote the book is because it should die as a test to be used to find out where your risk is of a heart attack or stroke. The stress test, I said I hate the outcomes. And the outcomes are everything looks good, or, we need to do more testing if we're gonna it's just a wrong test to see where your risk is of a heart
They
attack
really
because
are, yeah.
it's designed to look for a plumbing problem. So imagine you have a 5-lane highway system. You have to have 4 out of 5 lanes closed for it to show up on the stress test.
Oh,
Okay. So that's the stress test. So if you don't have it, then you're getting a clean bill of health. Well, let's go down that path a little bit more in depth. The majority of heart attacks occur with blockages that are under 50%. So it's like a pimple that's built up inside the vessel wall, inside the artery wall, like a pimple on our face, but inside the vessel wall. If that pimple pops, no big deal on my face, but if it pops inside the vessel, there's your heart attack or stroke.
yeah.
So you'll miss heart attacks looking at a stress test. So the doctor just has to say the right things to the patient. Say, look, you have a good fitness level. Seems like your heart can work well under loads. Doesn't mean that you're not immune to a heart attack. You could have one leaving this office. So please make sure you pay attention to your lifestyle. That took me seconds to say. That never gets said. So that's one. Second is that Houston, we found a problem. We've got 4 out of 5 lanes closed. We got to go do some more testing. We got to go now investigate this further. We got to do more radiation. We got to maybe find ourselves doing an angiogram where we find out where the plumbing problem is on your arteries, and then you'll do a stent or a bypass surgery. Now the trials have shown since 2005 to even to today, it shows that doing stents and bypass surgeries, doing surgery for blocked arteries is often unwarranted.
Okay, no, I'll bite. That's curious.
That medications is just as good of a treatment option than going in and intervening. Okay, I'm talking two different things here. So this is very important. We talked about the stress test outcomes. If you failed it, this is what you call stable heart disease. I'm not talking about the same thing where you're getting angina, chest pain, go to the hospital, and
Yeah.
you're actually having a heart attack. That's emergency. Heart stents, bypass surgeries are life saving then. I'm talking about walking to your family doctor's office, finding out you have a plumbing problem, and then going to get it fixed in the emergency room just because that's the way it's supposed to go. The data shows that we don't do that anymore.
Okay.
That's why the death of the stress test is there, is because it's the wrong outcomes. Now, what you should do now, the stress test is valuable. I already mentioned it. But if you found the plumbing problem, fix it with medications right away, especially if the patient has angina or chest pain. So you can fix it right away and do something. You don't have to go in and intervene and stent and bypass. But again, this is where insurance companies and lawyers get into play, is that if you didn't, the old data shows that, hey, why didn't you do this test to see where the plumbing problem is? Because they ended up with a heart attack. So there's always a fear of, to the physician level, what is it the best option? What are the guidelines? And the guidelines don't always show they're up to date.
Makes total sense. So, I mean, it's almost prescribing scared in a way. You know what I mean? Like we're told to do one thing,
Yeah.
follow the thing, or it's going to be an
And
issue.
there's things that you can do. There's addressing the biology. Get all the blood work, blood markers, see what's going on. Get all the biology addressed, whether they be medically or naturally. That's one. And then two is to be able to heal that vessel wall, exercise, external counterpulsation. These are all treatment options, hydrogen therapy, ozone therapy, chelation, all these things that can help the artery wall function better. So there's all these natural things that you can do if you choose to be able to heal the vessel wall without opening up your heart or getting in a metal
Right.
object inside the vessel wall. Again, that is life saving if you're actively having a heart attack. It's not if you have.
What'd you say the best type of cardiovascular exercise is? High intensity, low intensity for somebody who has an active issue with their heart?
If they have an active issue with their heart, I always try and lean towards zone two training. I think that's always important. But from that, then it's important to be able to do strength training. I think strength training is the best exercise.
Great. Well,
And
okay. Well, why is it? I'm curious.
just because of what it does from an insulin resistance to the benefits of strength training are huge. And so patients can do that exercise relatively in a good range of motion, still maintaining breath without any huge contractions to be able to see a good benefit to the artery wall. Because the artery is a muscle.
Mhm.
Training your muscles is also going to be a benefit that way too.
Oh, for
So
sure.
doing a combination of both, but you know, strength training is going to be your priority.
But HIT or a high intensity is probably not the best type, right?
Well, it depends on the person. I think this is where you got to personalize people and just not generalize everybody.
Okay.
But if I were to generalize people, it'd be, hey, get zone two training under you and then start training.
All right. What about diet? Are you a big person against red meat and things like that? Or
Blood test. You got to test yourself. You got
I
to know your
love that.
genetics. You got to be able to see what's happening. To try and generalize everybody into a Mediterranean diet or a paleo diet or plant-based diet, you got to be able to look at your numbers and your genetics and see what you can metabolize well. I think that becomes important. Eat to your micronutrient imbalances, eat to your imbalances that way. But I think if I were to just give a general rule of thumb to everybody that's listening, and I say it in my first book, Beating Heart Disease, is that if anything has to advertise to you, stay away from it.
That's very good. I actually like that. That's a good point. So I'm curious, but back to the actual testing itself. What are your thoughts on the inflammation testing, the PLAC and the HSCRP?
Yeah,
Do you know
all
those work
important
well? Or?
markers, and I have to understand that the endothelium, which is the inner lining of the artery wall, that gets damaged, and if it gets damaged, that's where problems can occur. And so there are markers that can look at it, and you can heal that. So once you get to knowing those markers, you can heal it. You want to close that lining of the skin that nothing can get through, and so that's why you know I can't stress enough the benefits of vegetables and fruits. There's so many antioxidants and power inside of those things that people don't get enough of it. People are lucky that they get a few servings a day.
Also, when it comes to blood pressure, this is also a big one. I read a couple studies. I forget. I think it came out 2 years ago. They said the amount of people who are on blood pressure medication that shouldn't be on it is pretty astronomical, just because they have a blood pressure high one time. Did you follow that suit as well? Or did you find that too many people might be on blood pressure medications that can cause a lot of side effects?
Every pill has benefits and risks. And I think it's always important to understand both of them. So you can come off of anything, in my opinion, if you give your body the environment to be able to do so.
No, okay, yeah, cool. So at your clinic, how does it work? Somebody comes in, you test them right away, and then you kind of put them on a program of diet, exercise, and different medications and pills.
Yeah, we personalize everybody that comes through. So yes, we do testing. We get extensive labs on them and see what's going on with them, so we can understand what's the next steps with them. But yeah, it's about personalizing everybody that comes in. It's not just generalizing everybody. And yes, we could generalize people because we've been doing this for a while, but not everyone falls into the same bucket. And not everyone needs to be able to do the same thing. So some person has to work on their gut health more than the other. Some has to work on their hormonal imbalances. Some has to address their genetic factors. Whatever be the situation, you got to know what's happening. So you only know that once you test it.
And you guys do all that at your clinic? Oh,
Yeah, of
fascinating.
course. Yeah.
That's awesome. Do you guys have people who work with your patients who do actual, custom diet plans, custom
Yeah.
exercise plans as well, or is that
Yes.
something the
Yeah.
patient finds?
Yeah. It's all personalized to their blood work. So
Oh, that's fantastic. Well, very, very good. Not many people do that here. Now, do you find that Canada is an easy place to practice those kind of things because those don't really fall under government based
I mean
prescribing?
it's a private focus. And so it's a little bit more you get to go more in depth and people are looking for answers now, and especially since I'd say since COVID for sure, it's just been, people are looking for answers. They're looking for hey, what more can I do? Because, I've been told something and I don't believe it, or I don't told like there's a lot of questioning that's happening.
Okay, that's good to
And
know.
so, you know, and a lot of podcasts like this are coming out and talking like it goes beyond cholesterol. It's not to say that cholesterol is not part of the plaque building process. It is, but it's if you look at a plaque, it's 30% of a plaque. And so you got to be able to think outside the box to see what else there is that you can do, especially if you have a disease process or you're trying to prevent it or you're trying to get cardiovascular longevity, which is our focus as a clinic. There are different things that you can do to be able to understand what's happening.
Do you guys do a lot with sleep as well?
Of course, yeah, sleep is a big inflammatory marker. So we do test for sleep,
Did you
sleep apnea.
are you doing at home testing, or how are you doing that?
Yeah, we send that off to a referral company here that does that. So,
Okay, very cool,
yeah.
very cool. So I'm curious to give advice to anybody who's in the practitioner world, doctors, nurses, whoever it could be, who's looking to get more specialized like you are, more personalized, which again, but not many people really focus on that. What's some of the best advice you could actually give to these people?
If they're getting into this field, I think
If they're
it's,
physicians or healthcare practitioners who are looking to
yeah,
kind of go beyond traditional, just cholesterol,
yeah.
this and that and the other.
I think we're in a world where, I got a lot of friends that are physicians and, you know, back in when they started practicing, let's say early 2000s, they would not let anybody go on the internet before coming to see them. And now everyone's got I don't know where my phone is, but everyone's got a phone where they can pick it up and say, hey, Google, what's happening? Like, tell me about this drug or that drug or side effects, whatever. So we're at instant access. And now we're in the world of, the chatbots that are getting out in the AI world. And now that's going to be even better. And so my point I'm trying to make is that you have to accept that the person that you're going to see is going to be a lot smarter than you.
Okay.
And and that's okay. Like the goal is not to be smarter than AI. You can't be. So don't be. The goal is to be able to help people navigate things appropriately so they can get the best outcomes that they're looking for. And with the world of, chatbots and AI and all that stuff, practitioners should be using that to help them be a better practitioner. And so for someone who's coming inside of this, you have to understand there's a good balance. And we'll go into this all the time is that, Western medicine has some great benefits. I mean, look at all the studies and the benefits and things and vaccinations that have come out to help people. But there's also the Eastern side of the world where there are some alternative practices that doesn't get the money to be able to help understand what, diseases that you can reverse. They've been stopping it for years. Now you're starting to see a lot more balanced. And it's because we have instant access to things. We've got instant social
Yeah,
media. We've got instant people talking about podcasts, Instagram reels, whatever, Facebook, TikTok, whatever you want to talk about. Now it's brought that a little bit more into the middle. And so if you're a conventional practitioner and you're going through that world, you have to open your eyes over here because you're hearing the stories, you can't just omit them. And understand, I get it. We talked about it from a legal perspective, but that, it's no longer imbalanced anymore. I think we're getting a little bit more of that balance, what it should be, the best of West and best of
exactly.
Eastern medicine. And as a practitioner, if you're on the Eastern side of things or Western side of things, understand that there are benefits on both sides and you can play both sides of the coin and fairly and safely and understand, hey, this medication might help me over here, but this supplement or herb or nutrient might help me over here, and I'll get my desired outcome to what I'm trying to achieve. And so if you're a new practitioner, I think it's important to be able to understand and have an open mind and a open heart to be able to see the differences of what's happening and not I think I remember a doctor telling us, like, they quit smoking and they quit smoking in the weirdest form. Who cares how they quit? They
Exactly,
quit.
for sure.
Like, who cares? Like, I remember this doctor early in my career. He's like, he got mad at someone for quitting smoking because they did something really stupid. And I'm like, who cares how they quit? They
They got
quit.
across the finish line, yeah.
Like, if someone loses weight and they like, and okay, yes, there's medications and stuff that can do it, but if they did it in the most bizarre way, who cares? Give them some props that they feel better, they look better, give them some props. we can change the things that you don't want. Like, okay, we got to start some strength training now. We got to maybe get some micronutrients back inside of you, or whatever be the situation, or get release of some toxins that you might have. We can now fix that, but you can't really, like, people. One thing that's never going to change is people's psychology.
True. Very true.
For years, since whatever, us as cavemen, the psychology of us haven't changed.
No, it's very true. It's nice to sit there and see. I think you're 100% right. There needs to be a mesh of Eastern and Western medicine because there's good aspects of both. There's also bad aspects of both. So yeah, I definitely agree with you on that one. Second question I have is if you're a patient or somebody who is listening to this and is just like, what are the top 5 things I can do right now to change my heart biochemistry, my heart health, things that I can do at home and is free.
Well, that's my book. The
Yeah.
first book, Beating Heart Disease. Yeah, I mean, I'll give it to you. Is like, obviously movement is important. Exercise is very important. The second one is obviously eat well. Talk about, if something has to advertise to you, stay away from it. Like, that's a
I
very
love that
important
one.
thing. Vegetables, fruits, they don't advertise to you. Fish, meats, they don't advertise to you. So stay away from someone that has to advertise to you. That's always important. Stress is a big one. We're in a world where a lot of stress happens, and not that you can ignore it, but the problem is, as humans, we like to take it and make and compound it. And
Yep.
so if you can have good stress coping strategies, that's important. The heart's a love muscle. So
Yep.
that's my fourth one. And it wants to give love. It wants to receive love. So relationships are very important. And I'm not asking for everyone to fall in love. That's not easy for everybody. And I mean, you can fall out of love and a lot of complications can happen from that. But just having a good community around you, friends, relationships, whatever it is, society, whatever that whatever that heart can connect with and can receive that connection back to. So it doesn't have to always be love per se.
I love that.
But
Good advice
love is
for a
love
lot of
is
people.
always a good thing. And then the last one is mindset. You want to be able to set the right mindset for success, because without that, you're just going to walk around blind anyway. So
I love that, my man. Well, good. So where can people find out more information about you and your books?
yeah, heartfitclinic.com is where we have our books. And
Great name, by the way, Heart Fit Clinic. Kudos on that one. Well done.
yeah, thank you. Yeah.
And so the books are there as well.
Yeah, the books are available on the website too, and I'm sure you might find them on Amazon too. But yeah, they're all there. Heartfitclinic.com has it all. So
Awesome. Well, Diamond,
yeah,
thank you so much for stopping by. It's been an absolute pleasure.
my pleasure.
Again, this is a Lifestyle Medicine Podcast. I'm Dr. Ivan. If your doctor's not checking your labs, they're not a doctor. And again, access, rock and roll. But again, thank you so much, Diamond, for stopping by. It's been a pleasure.
My pleasure.
Thanks for joining us today on the Lifestyle Medicine Podcast. At Access Labs, every innovation we pursue is driven by one bold purpose: making personalized medicine more practical and accessible for patients and providers. If this episode sparked new ideas or challenged how you think about patient care, awesome. Follow the show and share it with a colleague who's ready to level up their practice. Head over to our website at accesslabs.com and register your practitioner account today. You'll get access to over 1,000 routine and advanced biomarkers with 24-hour results. When signing up, select Lifestyle Medicine Podcast as how you heard about us and score 10% off your first invoice. Oh, and don't forget, drop us a review. It helps more practitioners like you find us. We'll see you next time.